Good evening, America. I am Crystal May, Director of FEMA. I regret to inform you that the current influenza vaccine distributed for this flu season was found to be contaminated by a thorough investigation conducted by the Center for Disease Control and Prevention after various reported incidents. Not all vials were reported to be contaminated, but it is unknown which ones are and which ones are not. The vaccine was distributed to the following 21 states: Maine, Connecticut, Massachusetts, New Hampshire, Rhode Island, Vermont, New Jersey, New York, Pennsylvania, Ohio, Michigan, Indiana, Illinois, Wisconsin, Minnesota, Iowa, Missouri, Nebraska, Kansas, North Dakota, and South Dakota. The residents of these states are at an increased risk of being infected or becoming infected. Infected individuals have shown symptoms of vomiting, diarrhea, high fever, and headache within 30 days of being injected. The vaccine was confirmed to attack the nervous system, causing paralysis and even death. As of now, over 2 million illnesses have been reported, with over 256,000 cases of paralysis and over 54,000 deaths. This illness is expected to become more widespread. More rare and serious events may occur because people of all ages and health conditions have already been vaccinated. Some individuals may be permanently paralyzed or disabled. This illness may have triggered other health conditions, causing symptoms to be more severe. The long-term health consequences for those who survive exposure is unknown. A long-term medical surveillance program will be established to monitor potential health effects of those exposed. In the future, citizens will be fearful of using vaccines to prevent contagious illnesses that may be classified as epidemic. This type of response may impact future attempts to prevent widespread illnesses. Psychological disorders are also likely to surface during this catastrophic occurrence. Currently, individuals have no way of knowing if they are infected until they become ill. People with other naturally occurring illnesses might fear they are victims of the tainted vaccine. Large numbers of people are expected to flood into doctors' offices and emergency departments. Qualified healthcare professionals are prepared to help as much as possible, offering medical treatment. Recovering from a disaster is usually a gradual process, but safety is our primary concern, as well as the mental and physical well-being of all American citizens. FEMA is coordinating management activities that include measures to alleviate damage, loss, hardship, and suffering caused by the synthetic vaccine to protect public health and safety while providing emergency assistance. FEMA will implement the Federal Response Plan, cooperating with state and local emergency response agencies. State, local, and federal agencies have played a huge part in providing information, assistance, and are offering a variety of services to residents who are in need in affected areas. Local response to this emergency situation will utilize the Incident Command System to ensure that all responders and their support assets are coordinated for an effective and efficient response. Local assets alone will not be sufficient enough to meet the emergency response requirements, so the states have requested assets through the State Office of Emergency Services. Due to this medical emergency being so large, state assets are also insufficient and unable to meet emergency response requirements. Federal assets have also been requested through the FEMA Regional Operations Center. The National Incident Management System is proactive in guiding departments and agencies at all levels of government, along with the non-governmental organizations and private sectors, to work together to manage these health incidents involving all threats and every hazard in order to reduce the loss of life and harm within the environment. The National Incident Management System is intended to be used by the whole community. Government resources alone cannot meet all the needs of those affected by this catastrophic incident. People through the community and our nation are pitching in to help the response effort. In the meantime, all citizens are asked to stay calm and being asked to utilize universal precautions along with personal protective equipment for protection against exposure. If any person is experiencing symptoms, they are cautioned to go to their nearest hospital emergency department for medical treatment. Please avoid close contact with people who are sick. If possible, stay home from work, school, and errands. This may help diminish becoming contaminated and spread infection. More updates will be released as more information about this incident becomes available.